in response to really the emphasis on booster doses that came out on Monday of this week, we have added an additional 4,000 appointments to existing appointments in the system just for next week, and those appointments are being uploaded today. They might be up there already, I'm not sure, as well as an additional 4,000 appointments for the following week. We've been looking at expanding capacity through two main ways. One is by expanding at existing clinics, the number of people we can see go through that clinic, as well as adding additional clinics. There's a couple of things that do limit our ability to expand even further than that. So one is that when we were at the height of our kind of vaccine clinics several months ago, we did have increased support and capacity from hospital partners. You might recall that some hospital partners were running clinics that were able to offer 1,000 appointments a day. Those hospital partners are now under significant pressure related to services at their facilities, so they're underserved. They do not have the ability right now to support vaccination the same way that they did several months ago. Primary care is being asked to further support immunization, and you will see some primary care clinics, again, to the best of their ability, based on current demands, be offering vaccination either through their clinics or in supporting the health unit-led clinics. I'd encourage anyone that is still anxious to get a booster dose and that does not have an appointment, if you would like an appointment at a health unit-led clinic, to recheck PBS as we are uploading additional clinics. And then there are other opportunities. So ensure that you have checked the pharmacies in your region. We do know that they are continuing to receive vaccine. We know that some pharmacies have been administering up to 200 doses a day and seeing a huge number of people come through. The province is working to quickly resupply vaccine to pharmacies or to health units. Overall, supply in the province is not a concern. What is more of the rate limiting factor is the actual resources in terms of humans who deliver vaccinations or put jabs in arm, and then the venues that are available to be able to see the most efficient clinics as we can, see the highest number of people come through in a day. The venues that we were using previously, like hockey rinks, are now being used for other ice-related activities. And so we just don't see the same venues to have the same volume of people come through. That being said, we're doing everything we possibly can to maximize opportunities both this week and next week and the following week to try and meet this expanded demand for booster doses. A couple of notes related to health unit-led vaccination clinics. Starting tomorrow, we will not be accepting walk-ins for booster doses. I also saw the media reports of long lineups at some of our clinics this week. And given the demand, we have decided to stop walk-ins for booster doses, but we have added appointment clinics to our clinics for the next couple of days. And then in addition to the number of appointments added to the system for next week. The other update I have related to our vaccination clinics is that moving forward, we will be asking clients that come to health unit-led clinics to be putting on a surgical mask or a medical grade mask. That people will be asked to either exchange their cloth mask for a medical mask or to just put the medical mask over top of their cloth mask. And this is consistent really with many other facilities or locations offering or providing health care. And we want to ensure that, especially given the Omicron variant, we are doing everything to the best of our ability to ensure health and safety of the clients we're serving, as well as the staff at the health unit.